Welcome to Meridia. This is Umar Tariq. We do another mock interview of another Meridia mentee. We have Dr. Bushra Zafar Sayed here. Hi, Dr. Sayed. How are you doing?
Hi, I'm good. How are you, Dr. Tariq?
Good, good, good. So tell me a little bit about yourself.
So basically, I'm an international medical graduate. I was born and raised in Pakistan, and I am currently working as a research assistant to Dr. Ranjot Gill, who works at Virginia Commonwealth University. I started medicine because I belong to a family of doctors, and I always saw my parents give so much to the community and their dedication to their profession as well. And that really inspired me. Also, I am very passionate about teaching, so I would like to be affiliated with the academic side of teaching in the long run. And in my spare time, I like reading books, I like cycling, and I also like to play throwball and watch tennis.
Okay, thank you. So what specifically interests you in internal medicine?
I like internal medicine basically because of the fact that I see a blend of various disciplines in under one umbrella, and I see how it is so essential to consult internal medicine, probably for almost any specialty that you can imagine. Because I remember I was posted in my surgical ward during my internship, and I saw that even when a patient with an infertility came, and we did a CAT scan on him, on her, and it showed out to be abdominal tuberculosis. So we had to eventually consult internal medicine, which was again something that I realized that you cannot go through a lot of things without consulting internal medicine.
Okay, interesting. So I read it in your personal statement that you're a passionate throwball player. I'm not aware of throwball at all. What is it as a sport? So can you tell me about the game? What is it? What is throwball?
Oh, for sure. So throwball is basically a women's sport in the subcontinent. It consists of two teams of 9 players each, and you are basically separated by a net, like you are in volleyball. The only difference is that when you throw the ball, you're supposed to catch it, as opposed to volleyball, where you're not supposed to catch it, just hit it with your basically forearm.
Okay, then how do you score?
So when somebody drops the ball, you keep throwing the ball, and then when somebody drops the ball, that's how you score. And you're not supposed to move from your position with the ball. That's also one of the rules.
So you're just basically throwing the ball, and is the ball big like a soccer ball, football, or is that like small like a
Yes.
tennis ball?
No, it's a soccer ball, but it's really light because
Okay.
it's not supposed to hurt your hands as well.
Okay. All right. I also see in your personal statement you talk about your experience at Sindh Institute of Urology and Transplantation, SIUT, and you mentioned that it was a specifically challenging experience for you and it was a huge learning curve. Why was that?
Basically, I have seen through the years that I've worked in the hospital that I get too involved, emotionally involved with patients, and I tend to, and that kind of at times tends to falter my judgment. So when I started working in oncology, the first thing that I thought it really made a difference was that I was able to communicate with the patients in an indifferent manner, to the extent that I practiced better how to deliver news that was not good. And also, one of the things that I realized was that how compassion in physicians can have such a huge impact on the patients, when at times you don't even have any treatment for terminal cancer patients, but just the way you talk to them, you change their lives. You make them feel good about themselves just for a day. And that kind of like really resonated with me. So yeah, I thought it was a game changer, because you can know all the things by the book, but how you deliver and how compassionate you are in medicine does wonders.
Okay, thank you for that. So I see you also worked in pediatrics and you worked in GI. So tell me a little bit, what you're interested in internal medicine. Why did you decide to work in pediatrics?
I thought it was at that time. So basically, I wanted to explore all my options. When we think about family medicine, so it comes you kind of get in touch with pediatrics and OB and all of that as well. So I really wanted to know where I was drifting towards. I wanted to keep all my options open, and if I had the chance, so why not rotate and actually get to know all those fields really well? And I think even in internal medicine, it's going to help me in the long run.
Okay, so how did you decide between internal medicine versus family medicine?
Because I I thought that I would deal with adults much more easily as compared to children,
Okay.
and I felt that even though there's nothing wrong with it, but the thing is with children, you kind of don't know when they're in pain or when something's not right, and it's a whole different dynamic. So
Okay.
I just felt that it would be my comfort zone basically to be in internal medicine.
Share an interesting case from your GI rotation that you did in Plano, Texas.
An interesting case would be an IBS patient, actually, irritable bowel syndrome. So, as you know, it's basically you rule out all the causes and then you diagnose the patient. And it was very interesting because he said that the only time that he had a comfortable bowel motion was in his office rather than at home, which was something that I could not really like imagine, that how could he be more comfortable in the office, but it was very interesting in that sense. And this is basically one of the things that I saw in the US, which was quite different from Pakistan, because at times we don't really do endoscopy or colonoscopy to rule out IBS, but we have to do it here just because it's evidence-based medicine here.
Okay. So other than the endoscopy, did you guys do any other additional testing?
We did a colonoscopy as well, and because we wanted to rule out any polyps for the
Mm-hmm.
reason of his diarrhea or constipation, and there was no cause that was found. So eventually, he was started on antispasmodics such as
Mm-hmm.
dicyclomine,
Okay.
and yeah,
Did that
yes,
help him?
yeah, it did help him. For the time that I was there, it did help him. I was there for basically 4 weeks,
Mm-hmm.
so I hope
The
it's still
short-term
helping
follow-up
him.
was okay.
Yeah,
Okay. What do you think is your biggest strength as a doctor?
my biggest strength, I would say, would be the fact that I'm not just treating it as how people treat it as like a puzzle or something that's just meant to be solved, like cases are just things to be solved. I take a very in-depth approach to it, and I like to take care of not just the patients but their family members, and how news is basically delivered to them, and the treatment options that are told to them as well. So I think that kind of distinguishes me, and that's one of the things that I found that was very encouraged during all of my work, that I was quite different from everybody else because I actually took out the time to sit with the patient, talk to them, and better understand their perspectives and explain the point of view much more simplistically.
Okay. So you have lived in US and in Pakistan, right? So how do you compare the life in both the countries and both different cultures?
It's actually different, but depends on your own perspective. So I'm very close to family, and I have family in the US and Pakistan, both. So, and I've always lived with my family in the US as well, which was one of the reasons that I did not find it very alienating to me. And I always had guidance, and I always had people around me who I knew. But the thing is that the quality of life is definitely much better in the US in terms of the general the general roads, and then even to the fact that you can return something that you buy in a store much more easily in the US
Yeah.
as compared to Pakistan.
Yeah. That some people even abuse that. So what is one thing that you think Pakistan has better than US?
Pakistan, for me personally, would be desi food, which is
Sure.
much readily available as compared to in the US, where you have to find find places or live in a place where it has easily accessible desi food. Otherwise, you make it yourself. Apart from that, yeah, I think pretty much it's not a huge difference, but yeah, the quality of life is better.
Interesting. What do you think is your biggest weakness?
My biggest weakness, over time, I realized, and my friends have told me too, is that I don't ask for help very often. So I try my best to do everything on my own, any task that I'm given. And at times, it doesn't hurt. It never hurts actually to ask for help. I've realized because I end up creating a lot of burnout for myself, losing a lot of time and losing a lot of efficiency in the process when I take it upon myself to do everything myself. So yeah, this and that is something that I'm working on definitely, because that's a part of being a team player, that you're supposed to ask for help and
How do you
always
improve
offer
that?
your own help as well. You start asking for help, and you also offer your own help, because so for example, if I'm given a task right now, and we're supposed to, if two people are supposed to take history and examination of a patient, then I would probably ask the person better equipped with EMR, whether I am or whether the other person is, and they can, do the typing part of it. The other person who is better with communication can do the communication, and the one who says that, okay, yes, I'm very good with examination, so they can do that. So it can be a teamwork.
Okay. What are you looking in an ideal program?
One of the reasons that I like your program is the fact that has a lot of it's very research oriented, and it is also the academic oriented, especially the clinical educator track, which I'm very interested in because I'm very passionate about teaching. I've done that through volunteer work all my life, and I plan on continuing to do that to teach future physicians as well once I'm a successful physician myself. And also, the other thing that I think your program is very attractive about is the cost of living and the fact that it's the general area, that the mountains and everything, because I really like cycling. So I think that it's going to be a joy for me. I like being in nature and doing all the physical stuff as compared to going to something like going to cinemas or something more digitalized. I prefer to be in nature.
Okay. So, uh, if you go to an island by yourself and you're allowed to take three things, what are those things gonna be? Those three things gonna be?
So I will take my best friend.
No, you
I
can't take a
will
human being. It has to be just three things,
okay, three things. Then I
and
would
you're by yourself.
probably take mhm. Then I would probably take a water bottle, and I would take something to cook, so a frying pan, because I'm gonna make the fire over there. And the other thing that I'm gonna take is probably a book with me.
Okay, interesting. Okay, where do you see yourself in 10 years?
In 10 years, I see myself successfully settled in with a family and probably some kids. And I see myself pursuing the academic side of medicine, being affiliated with your faculty, most probably in the future. And because I want to do, currently, I'm very driven towards an oncology fellowship, and you provide an in house fellowship for that. So I think it's the best option for me.
Okay. So, Dr. Said, I'll be honest with you. We do provide research opportunities to our residents, but we don't have a full-blown research track. And it's very hard. We're a very busy clinical service, and it's very hard for us to provide time off for research. So most of the times residents take out their own like free time and they use that time to work on different research projects. So just wanted you to be aware of that. Is that going to be a problem with your strong focus towards research?
No, not at all, because I've done research while working all my life,
Okay.
and because that's something that I'm passionate about. So I don't think that it's going to be a hindrance. I'm actually going to enjoy doing it. So it's not work. I'll be fine
Okay.
taking out my own time.
Okay. A second comment for you is we live, it seems like you're somebody who's very attached to her family. We live in central Pennsylvania. It's a pretty rural area. You'll be quite far away from your family, and you only get 3 weeks off as a resident to meet your family, go on vacations, sick days, all that. Do you think that would be a concern for you to live away from your family by yourself for such a long time?
I think, you choose your battles. So if I want to be trained, but I have family in New York and New Jersey, which is not quite far from central Pennsylvania. So I think it's not going to be that big of a hurdle. I will still be connected to them, and that's no problem.
Okay. Why you should be hired?
Because I think I'm curious, and that's what I've been told, that I'm never afraid of asking questions. So, and that's the entire point of residency, that we're supposed to be trained. We're not supposed to know everything by ourselves. And I'm very thrilled to actually learn from the faculty. I think it's going to help me achieve my goals, and I'm resilient, and also because of the fact that I believe that I'm a very easygoing person myself. I like to keep the atmosphere very calm. So I don't create tension for anybody else, do not create tension for my own self. And I think it would be helpful to have someone who can actually keep people together. And I'm a very good listener. So I don't just listen to respond, I listen to understand. So I think in my professional and personal setting, both, that is a great quality to have. I think that would be a very top-notch thing to have to. I don't think you can have many candidates claiming the same.
Okay. So you said you're pretty good at keeping everything calm. Can you give an example of when there was a situation of conflict and you were able to handle that and calm down everyone?
Yes, for sure. I remember that at the first day that I was posted in the ER, and I was the only doctor on the floor. The rest were the staff who was supposed to help me. So a patient came which was a broad dead patient, and I did all the examination, and they came with a lot of family, so there was a lot of hustle. And the thing was that I was quite young, so proving my point and actually being confident enough to deliver the news to them, and also calming the nurse and the staff down, because they were all like, okay, why don't we have someone senior come in, because I don't think you can handle the situation. So I explained everything to them, because at the end of the day, if you have good reason for what you're doing and why you're doing, then people will listen. So I explained everything to the staff first. First of all, I calmed down the situation. I told them that there was nothing that could be done, because the patient had all the signs of brain death. And then I calmly asked for one of the key family members to come in and explain the situation to them as well. And it was handled very well, but to the surprise of the staff members, I think. And after that, they realized that it's not the age that matters; it's your attitude, which is much more required in stressful situations.
Okay. Well, thank you. Thank you much. And good luck with the match. Do you have any questions for me?
Yes, one question that I thought about was that when I was going through your website, so it says a clinical educator track and a community outreach track as well. So I just wanted to ask, are those tracks decided at the beginning of the residency or later on?
It's both. Typically, we ask you to decide that before. but
Okay.
you have the ability to switch between tracks in the first year. After first year, your elective rotations are scheduled based on the tracks you choose. So um, just to be on the safe side, I would say choose your track before. But if you're not sure, you can do the regular track, and then if you feel strongly about one or the other track, then you can pick that track at the end of first year.
Okay. Perfect. Thank you so much.
You're most welcome. Any other questions for me?
No, not at all. Thank you.
Okay, well, good luck, Dr. Sayed, with the match.
Thank you.
All right, feedback time. Very good job. Very good. You maintained eye
Okay.
contact with the camera. That was phenomenal. That was very good. The smile was good. It stayed throughout the interview, except on a couple of times when I asked you some difficult, challenging questions when you were like,
Okay.
"Oh, what?" Bushra, the biggest negative critical feedback for you is fix your internet. This internet was very bad. There were multiple times during
Sorry.
the no, no, no worries. I'm just telling you so that you don't do that during your interview. Multiple times the video got stuck. I could barely hear you. So fix your internet. Invest in good internet at least for next 3 months or so.
Okay.
Your answers were decent. Uh, your tell me about yourself was actually good because it was crisp. The problem I have had with some of the candidates is like they're answering tell me about yourself, and it keeps on going and going and going and it doesn't stop. Yours was crisp, to the point, focused. I think you handled a lot of questions with a lot of grace and dignity, which is good. Um yeah, I other than the internet being slow, I don't really have any negative feedback. Uh, do you have any questions?
Not really. One of the things, okay. So probably my eye contact and everything. The thing is, I don't know if you know this, Dr. Tarek, or not, but I'm applying for the match the second time.
Yeah.
Yeah, so that's why I've been through all of that. And one of the reasons that I don't know if it was the reason or not, but in the previous match, I got an interview and I did really well. And they said, you better rank us. And the thing is, I forgot to put in the NRMP code in the application,
I don't
which,
get your question.
so
So
the thing is that I
you
don't
forgot to
think
rank
that,
them?
yeah. So do you think that could be the reason that, no, I
Oh,
ranked them, but I
yeah.
did not write my own NRMP code
Where?
in the application? That there's a box in the application you're supposed to write your NRMP code. So I was like,
Uh,
if I
I don't
can
know.
only search them up with their code, then
No, I don't think so. I don't think so, but make sure you write the NRMP code this time. I honestly don't
yeah,
know.
yeah,
I don't
I wrote
honestly
it this
don't
time.
know.
But that's one of the things that I've been thinking for a year and
Sure.
regretting that was that the reason. So that's I'm just asking you. Maybe you
Yeah,
know better.
nobody knows. Nobody knows. But let me ask you this. Somebody might ask you this,
Mhm,
that they
mhm,
know that you were an applicant last year. And I'm going to ask you
mhm.
this question now. And you're applying
Okay.
for match again this year.
Mhm.
You didn't match last year. Why do you think you didn't match last year?
Because at that time, I think I did not have enough like work experience. I did a couple of rotations after that. I did not. My personal statement was a bit below par, I would say,
Okay.
and also the fact that I did not have my step 3 exam done, and I was already not a fresh graduate, so that kind of I think would help my CV right now.
So now you are an older graduate. One more year has been added for your time since graduation. So what has changed since then, since last year?
um, Tons, I think, tons in terms of experience, in terms of the fact that just I'm so driven. Like I did not see myself so focused towards internal medicine last year as compared to how I'm focused right now. I did not have a specialty or a fellowship in mind. But now I think I'm much more primed to actually go into residency. I think now I'm truly ready. Like this is
Okay.
my time.
Okay.
Yeah.
Well, good, good. Your answers are decent, and I hope if you somebody asks you these questions, you answer them. Yeah, I think you did good. Just work on these things. Somebody might ask you these questions, especially why you went unmatched and what changed since then. Any other questions for me, Bushra?
Mhm.
No? Okay.
Not really. So just the internet connection, I should get like a
Yeah,
better one.
please do.
Yeah.
All right, everyone. I hope you all learned something from this interview. If you did, please like it, share it with others, and subscribe to the channel. And like we always say, never give up, never lose hope. Bye.